Jasleen, we can start.
Okay, fine. So, good afternoon, everyone. It's almost early morning here, so I'll be giving the lecture on the topic of stress management. I hope can may I know about the audience.
Sir,
There.
sir, please, sorry to disturb you. Firstly, we will start from our side, sir. Then you.
Sure, sure.
Jasleen, we can start.
Or shall I wait for a while? Let them join. Okay.
Yeah. It take time.
Good afternoon, sir.
Good afternoon. So the students are from undergrad level.
Can
Which
I start now?
voice is not audible completely.
Okay, sir. Sir, wait. Sir, am I audible?
Yes, yes, you are audible.
Hello?
Yes, yes, you are audible.
You audible?
Am I audible?
Yes, yes.
Okay, sir. And good morning to all. Good afternoon to all. Myself, Jasleen Kaur, Assistant Professor in the Department of Pharmacology at Amar Shahid Baba Ajit Singh Jujar Singh Memorial College of Pharmacy, Bela. I feel truly honored to serve as the host for today's expert lecture and will be guiding you all throughout the session. As our institute proudly celebrates 51 years of its remarkable journey, today's expert lecture stands as yet another step in continuing our legacy of learning and growth. Before we begin, I would like to take a moment to introduce our esteemed institution, Amar Shahid Baba Ajit Singh Jujhar Singh Memorial College of Pharmacy, Bela, one of the premier institutes in the northern region. Established in 1993 by a non-profitable society in the sacred memory of Sahibzadas Ajit Singh Ji and Jujhar Singh Ji, the brave sons of Guru Gobind Singh Ji, who sacrificed their lives at a young age. Over the past 3 decades, the institute has achieved remarkable growth and offers a wide range of programs, including diploma, bachelor's, and master's in pharmacy, MSc in pharmaceutical chemistry and microbiology, and bachelor's in medical laboratory science. An autonomous institution affiliated with IK Gujral Punjab University and with great honor, I introduce today's expert speaker, Dr. Ansab Akhtar, an accomplished researcher and academician in the field of neuropharmacology at neuroscience. Dr. Akhtar is currently serving as a postdoctoral research fellow at Louisiana State University Health Science Center, Neuroscience Center of Excellence, New Orleans, USA, where his research focus on neural circuit development, brain insulin resistance, and neurodegenerative disorders such as Alzheimer's and autism. He holds a PhD in pharmaceutical sciences from the prestigious University Institute of Pharmaceutical Sciences, Punjab University, and the Masters in Pharmacology and Toxicology from Naipur, Hyderabad, and holds a bachelor degree in pharmacy from Jamia Hamdard University, New Delhi. He has worked extensively on brain insulin resistance in Alzheimer's disease and has hands on expertise in stereotactic surgery, viral vector techniques, immunohistochemistry, QRT PCR, Western blotting, behavioral neuroscience, and advanced data analysis software like GraphPad Prism, BioRender, etc. Dr. Akhtar has authored several impactful research publications in highly reputed international journals, including the Journal of Neuroscience, Psychopharmacology, Brain Research Bulletin, Immunopharmacology, and Brain Behavior and Immunity. His research has received over 950 citations and an H index of 15, adding his strong academic credibility. He has also been recognized with prestigious awards including GPAT 2013, UGC MANF Fellowship, and the FENS Grant 2020, and the IBRO Travel Grant to present his work at the Society of Neuroscience meeting 2021 in Chicago, USA. With his research excellence, Dr. Akhtar actively contributes as a reviewer and editorial board member for leading neuroscience and pharmacology journals, strengthening the scientific community. Now, with great respect and anticipation, I invite Dr. Ansab Akhtar sir to kindly deliver his expert lecture and enlightening us with his valuable insights on the topic stress management, pharmacological and non-pharmacological approaches.
Thank you, Dr. Jaslin, for this kind introduction. I really appreciate that. So, before any delay, I will just start the topic to present. And the
Okay,
topic
sir.
you mentioned is on stress management, which is very common nowadays, almost in all professions, including the students. Stress comes in many forms like anxiety, depression, other psychological disorder, including in children and adults, and even the Gen Z in Gen Alpha. And the reason are several. And nowadays, the most common reason is the digital world. So for that, I'll be telling both pharmacological and non-pharmacological approaches. Pharmacological approaches will mainly include the drugs, the subject which is included in many medical courses, including MBBS, B Pharma, BDS, and even nursing courses. So I'll be focusing mainly on the non-pharmacological approaches because pharmacological drugs mostly we go through, but non-pharmacological approaches have advantages over the pharmacological one in terms of that these non-pharmacological approaches have almost less side effects and more easy, more convenient to use and easily available. So the roadmap or objective of this talk or this lecture would be to understand the definition and types of stress. What are the various types, like I mentioned in the first slide, that it could be main in the two forms, anxiety and depression. Anxiety is a thing which that is the, like a student has a fear before exam, or someone has the fear or stage fear before a talk, or someone who is working in the office have to perform best. So these are the types of fears or anxiety. And depression could be arising in someone has a trauma, someone a relative has died, someone failed an exam, and other issues which might lead to the condition in which the various chemicals in the brain, most common of them are serotonin and dopamine, their low levels arises, and because of that the symptoms could be both in the form of physiological and psychological. Earlier days only the physiological symptoms had been studied, but nowadays the various other psychology in the form of psychological disorders are being studied. So I'll be talking about various, briefly I'll be talking about the pathophysiology, because I'll not be mainly focusing on pathophysiology and pharmacology. I'll be mainly focusing on the what are the strategies could be taken to minimize the stress. I'll be briefly discussing various pharmacological and non-pharmacological approaches and explore integrated care, special populations, and future direction. What could be the strategies in future we can take? Like for example, the artificial intelligence is the thing which is being explored extensively nowadays. So the brief introduction of stress is the physiological and psychological response to demands. Like if you're having an exam next day, so it will be demanding to perform you better. If you have to travel tomorrow for a long distance, you have to prepare for that travel. So that demand is will be responding in the form of anxiety. So this demand could be both in the form of physiological and psychological, and this stress could be in like for a short term, for a medium term, or for a long term. On that basis, we can divide it in acute, that means short term; episodic, that means at certain circumstances; or chronic. So chronic stress is actually main detrimental to health, and it could be fatal at extreme cases. Like it could be leading to suicidal thoughts and even suicide if the stress is chronic. So the strategy to minimize that, when it is in acute form, that could transfer to the chronic form for if it is not handled or treated or managed initially. So that is why I'll be telling you how to manage the acute stress, which could prevent us to go through this chronic stress, which is actually fatal. So impact could be, the symptoms could be in the form of physical, mental. So physical symptoms could be like the person might be having the higher heart rate or the higher blood pressure, and that could be leading to, if the extreme case happens, that could lead to cardiac arrest. Immune dysregulation, because of this immune dysregulation, the person will be unable to defend a disease, and that's how it leads to the other disease, and that's how it appears as comorbidity. And mental symptoms could be like in the form of anxiety and depression, most common form of stress. So historically, the first scientist who introduced this stress thing is like is this person who had told about the concept of stress. So earlier, the stress was mainly observed as a physiological response. What is physiological response? Like I mentioned, physiological response could be like sweating, could be like increased heart rate, could be like uh, increased blood pressure. So these are the physiological response which had been studied earlier. But with time, in nearly last few decades, the shift has been come to biophysiological understanding and psychological understanding of this stress. So like our brain is having several regions, several areas, and all those areas have different functions. For example, we have the amygdala, we have the hippocampus, we have the prefrontal cortex, we have the hypothalamus, we have the olfactory bulb, we have other areas. So these different areas have different responses or different functions to control various psychological things in our lives. So the brain area of amygdala is you can see a small area here. So this is the amygdala, which is mainly responsible for fear conditioning. That means response to anxiety. On the other hand, hippocampus is the center of learning and memory, which is having role in diseases like Alzheimer and other cognitive functions. So when these brain areas are being affected, so how can these brain areas be affected? So that effect could be because of diet, improper diet, lack of exercise, or other environmental factors. Even the genetic factors could also be leading to the damage to these brain areas. So that damage could be leading to atrophy, that means size reduction or abnormal formation, and that finally leads to various brain disorders, including anxiety and depression, or even the other brain neurological disorders like Alzheimer, Parkinson, schizophrenia, psychosis, autism. So there are various psychological or neurological disorder, but here we'll be mainly focusing on the anxiety and depression, which are the most common form of stress. So the main conclusive part of this brain structure is that brain almost controls everything in our life, right from the stress to the work to the performance to the mood, everything. So that is how we have to understand the brain first, then we can be able to control the stress part. So this is the brief pathophysiology. I'm not extensively discussing the pathophysiology part. So HPA axis, you must have heard about this term, hypothalamus, pituitary, adrenal axis. So hypothalamus, as I mentioned in the previous slide, is the part of the brain which releases many hormones, including the corticotrophin releasing hormone CRH. So when this hypothalamus gets activated to release this particular hormone, when the person is having stress. So in case of stress, the person will be releasing more cortisol. So this is also known as stress hormone. So this gives a negative feedback to the hypothalamus to release more CRH, corticotrophin releasing hormone, which further stimulates the pituitary gland to release ACTH, adrenocorticotropic hormone, and this further activates the adrenal cortex, the this part is located in the kidney, to release the cortisol hormone, which is actually the stress hormone. So this is how the axis gets continued when the person is experiencing any kind of stress in their lives. So this is the cycle which gone was hypothalamus activates or releases CRH, and then it activates the pituitary gland, and further ACTH is released, then further it activates the adrenal gland to release cortisol. So amygdala is the brain region which I mentioned in the previous slide, which is actually detects a threat. Threat, what kind of threat we are talking about here? We are talking the threat in the form of anxiety or depression. Like we are feeling threatened or we are feeling fear when something has to be performed better, like we are under pressure to perform better at work, we're under pressure to get better marks in exams, we're under pressure to excel in life or any stage of life. So that pressure leads us to stress, and that is when the amygdala, the brain part, the brain region reacts or the stimulates, and that is what it further stimulates the release of various hormones like I mentioned, CRH, ACTH, and cortisol. So in that case, in case of stress, there is rewiring in the brain which can also happen. Rewiring is also may also come in the form of dendritic remodeling. So like our brain is made up of billions of neurons, that means this is very huge. Each neuron has their own function, there are various types of neurons. And each neuron is connected to other neuron through synapse. So you can imagine the diversity of this brain, and this diversity is the reason we are not completely understanding the brain. So extensive research is going on to understand the various connections between the neurons, various types of neurons, to understand the various neurological disorder, including the stress and including stress, which includes anxiety and depression. So this dendritic remodeling may happen when the person is having stress. So this is the brief epidemiology. Epidemiology means the prevalence of stress. And like you can see, this stress thing is mostly common in the teenagers, like or after the teenage, like 18 to 24 age. This is the epidemiology. So like this blue one is about the stress overall, and this black one is the depression, and this gray one is about the anxiety. That means the percentage in this age group. So further, when the person reaches above 40, generally the stress level might decrease. It is not necessary, but there are chances, because after a certain age, there are some hormonal changes, or the person is able to cope up the stress, or to understand, or to take a particular action to reduce the stress after a certain age. Because when the person is earlier, like in teenage or after the teenage, like 18 to 24 years, they are not able to understand the life completely, not able to manage the stress completely, or they are not not following a particular lifestyle. I'll also be discussing about the lifestyle, what kind of lifestyle we can follow to minimize the stress. So another graph here shows the various prevalence of stress type, like depression, anxiety, stress-related disorder, burnout. Burnout is another type of stress, which happens generally in professionals, like because of excessive work. Burnout, that means that can lead to headache, exhaustion, or even in extreme cases, it could lead to cardiovascular diseases or mental diseases. So this is having very high prevalence. So both developing and developed countries are having the problem of this stress. Like in US, the sometimes the work pressure is so high, that means it is very different from countries to countries, from cultures to culture. So that is how when we move from one country to another country, our mind, our brain takes time to rewire according to that environment, and with passing time, gradually, that rewiring is being not completed. At least it is modified up to some extent to adopt that environment. So that is one of the action that can be taken to rewire our brain neurons according to the work, according to the environment, according to the work culture. So this stress has actually led to economic burden also. Like if the person has to be treated for that brain disorder, like depression, anxiety, or burnout or stress related disorder, it leads to actually economic burden in terms of caregiving, or in terms of treatment. So mostly the student and healthcare workers are increased risk of stress. Other professionals other than the students in healthcare also go through that, but in case of healthcare workers, we are talking about mainly doctors or pharmacists or nurses. They are the one among healthcare workers might go through this burnout or stress. So I'll be discussing here about the pharmacological drugs. I mentioned in the first slide itself. I'll not be going in detail about the pharmacological, because these are the drugs mostly we read in almost all the medical courses, including pharmacy, nursing, or other paramedical courses. So some of the drugs categories are SSRIs, selective serotonin reuptake inhibitor. As I mentioned earlier, serotonin is one of the most common chemical in the brain, which decides our mood, which decides how we are feeling, which decides we are going through depression or not. So if the level of serotonin is higher, it will elevate our mood. So that is how selective serotonin, that means it will selectively inhibit the reuptake into the neurons. When the reuptake is inhibited, that means serotonin level in the brain is getting increased. And that is how it elevates the mood. If the person is having panic attacks, if the person is having depression, so this drug can be beneficial. Other category of drugs are benzodiazepines. So most common ones are diazepam or lorazepam, or alprazolam is another one. Alprazolam is commonly taken sometime by students before exam, but these drugs should never be taken without the prescription of the doctors. and that could be if we are taking it without prescription, it could be having hazardous effect on our body, on mind. Another category of drugs are barbiturates, which include pentobarbital, phenobarbital, amprobarbital. So, out of these, benzodiazepines are mainly used to reduce the anxiety. So that is why these drugs are called anxiolytics, and these are for short-term use. Another category which I mentioned, SSRI, selective serotonin reuptake inhibitors, selective noradrenaline, another neurotransmitter involved in our mood, but which is less common as compared to serotonin. And these are for longer management of depression, antidepressant. Beta blockers are the another category of drugs which are generally used for symptomatic relief. Like I mentioned in the initial slides, like we'll be showing our symptoms of stress in the form of increased heart rate or increased blood pressure. So in that case, to manage those heart condition or cardiovascular complications, we can use the beta blockers. There are other drugs also like calcium channel blockers, potassium channel openers can also be used, but most commonly we use the beta blockers like propranolol, atenolol, metoprolol. So these are used for performance anxiety or symptom control, the symptom which I mentioned, like symptoms related to heart and blood pressure. So nowadays, other categories of drugs like Ayurvedic medicines are also being tried or investigated. Research is being continued mostly in India or in these herbal remedies, and supplements are also available in the market. But still, we should be cautious while taking these supplements for depression and anxiety, and we should never be taking any drugs, including the supplements, without the prescription or without the instruction or advice of qualified doctor. So the mechanism of action of this selective serotonin reuptake I already mentioned. That means this inhibits the reuptake of serotonin, and that is how the level of serotonin increases. Benzodiazepines are the GABA A, which is the inhibitory neurotransmitter. When this is being enhanced, that means inhibition is being increased, and that is how it leads to the decrease in anxiety. Because in case of anxiety, there is overstimulation and fear. Rapid anxiolysis, that means it breaks down the anxiety. However, all these drugs have some drawback, and it should be taken with caution. Again, I'm repeating, it should never be taken without prescription, because it can lead to dependence or tolerance or addiction. If the person is taking for a long time, generally students sometimes take alprazolam, but it can lead to dependence. That means you'll be you'll start depending on that drug whenever you will be experiencing anxiety. So instead of taking any drug, you should try to manage the stress by other lifestyle management, which I'll be focusing in the coming slide, which is the major focus of this topic. So beta blockers reduce peripheral adrenergic symptoms like palpitations or increased heart rate. So nowadays, psychedelics are being researched. Psychedelics are the drugs which reduces the hallucination or euphoria or the symptoms related to psychological symptoms mainly. So psychedelics are not being prescribed yet. Still, the research is going on. Many of them are in clinical trials. So this psychedelics still has to be it still has to come in the market. So till now I was discussing about the introduction of stress, and I was talking about the pathophysiology, I was talking about the brief pharmacology. Now I'll be talking about the what are the non-pharmacological. What does it mean non-pharmacological? It means the strategies or the actions which are not including any pharmacological drugs, or which are not generally targeting any receptor or any pathway or any signaling cascade. So out of these non-pharmacological approaches includes the lifestyle changes. So mainly when we think about lifestyle, what comes in mind? So the thing which comes in mind about the nutrition, about the exercise, about the sleep hygiene, about the communication, about socialization, about yoga, about other mindfulness techniques. So these are the all non-pharmacological lifestyle approaches we can take. So out of these, some of the examples like cognitive behavioral therapy. You can see CBT, which is the most common non-pharmacological approach. Cognitive behavioral therapy. What actually it is, I'll be telling in the next slide. So others are interview. Interview, what does it mean? It is not the interview we are conducting for jobs. It is the interview in the form of counseling the patient. Which passion? The person who are having the psychological disorder or in the form of stress, in the form of anxiety or depression. So the patient is being counseled. That means they are being talked to by a psychiatrist or by a counselor who tries to understand their problem, the etiological factor of that depression or anxiety. So after understanding that factor, the psychiatrist or the counselor tries to find out the coping strategies, not in the form of medicine, but other strategies like the person has to take proper sleep, the person has to manage the stress, the person has to take this particular nutrition, the person has to socialize with friends and families, the person has to travel, the person has to go or explore the natural beauties which actually enhances the mood, all these strategies. So that is how counseling or interview can be done. So massage is another way, acupuncture, aromatherapy, that means perfumes or any kind of good smell which can elevate the mood. Video, that means the person will be shown the videos which will be relieving to the mind, that means the videos related to like music, related to a movie, related to a counselor or a lecture of a doctor or a psychiatrist or a motivation speaker. So these can be shown to the patient. Music is another way, acupuncture is another way. Acupuncture is a technique in which the person is pierced with some physical therapy. Spiritual, like I told, like yoga and other prayers, the person can do. Hypnosis, that means person is being made to sleep, take proper sleep or sleep hygiene. Relaxation is another form of mindfulness. So this relaxation could be by sitting, by lying down in a quiet, dark room and taking the deep breathing, inhaling and exhaling for a particular time. Like mindfulness can be done by inhaling for 6 seconds and then holding the breath for 2 seconds and again exhaling for 6 seconds. So that can be done for at least 10 minutes every day. That can actually minimize the stress up to great extent. Psychotherapies, like I mentioned, cognitive behavioral therapy. So accepted commitment therapy is another one which is less common as compared to CBT. So this is the most common one, CBT. Interpersonal therapy. Interpersonal means the person is being directed or instructed to socialize, to talk to family and friends, to talk to each other to minimize the stress. Mind body, mindfulness, yoga, breathing exercise, which I just told, you can do by your own. You can try to find out what could be the various breathing exercise which actually relaxes the mind, relaxes the lungs, relaxes the entire body. Digital interventions, even though the digital world has increased the stress level, but there are certain apps uh, which can guide you to manage the stress. Okay, so these digital interventions could also be in the form of artificial intelligence, and there are various apps you can use to minimize the stress instead of misusing the digital world. You can put it in a positive way. Teletherapy is done through phone calls to counsel a patient or at a distance. Biofeedback is another way of digital intervention in which the person's body is being weared with a particular instrument like a watch, like a smartwatch, and there are various parameters of the body, including the BP, heart rate, palpitation, are being recorded, and further, the person is being treated according to that biofeedback. So these are the digital intervention, which is even though very less common, but in coming years it might explore in the form of mostly in artificial intelligence. I'll be talking more about this. So like I told in this slide, the most common one of these non-pharmacological approaches is the CBT, which is called cognitive behavioral therapy. So in cognitive behavioral therapy, first the person is being identified. That means person's thoughts, what kind of thoughts in their mind, what kind of thoughts come in their mind. So how the psychiatrist or the counselor understand their thought by talking to them, by extracting what's going in their mind. That's why they are having the particular kind of stress, and then challenge distortions. How the counselor will be challenging the distortions? That means the person will be told to engage themselves in some other tasks so that that particular stimulator which causes this particular anxiety will be reduced. So that is how the challenge, the thought is being challenged by the counselor. So this is being told to the patient, you have to challenge that thought. So that thought, which is the reason of that stress, will be reduced. And further behavioral experiments are done, or behavioral therapy is done. That means the person is being told to perform a particular task, like in the form of exercise, in the form of breathing, in the form of mindfulness or yoga. And then relapse prevention. That means person will not be having that particular stress in future. So for that, strategies has to be continued. That means the strategies or lifestyle changes will not be for the shorter period, but it will be continued for whole life. So identify automatic thoughts and cognitive distortions, challenge and reframe those thoughts. The thoughts has to be reframed. That means the person has to be counseled to change or replace those negative thoughts with positive thoughts. So that is how the thoughts are being reframed. Then behavioral activation and exposure techniques. The exposure techniques may, all these can come. Exposure techniques, right from the counseling or listening to music or aromatherapy. So these could be the exposure techniques. And then relapse prevention, that means further the person will not be having that kind of thought. So that is called relapse prevention, and it has to be maintained. As I mentioned, it has to be maintained for entire life if the relapse has to be prevented. So another strategy is mindfulness and meditation. So we all do prayers. So prayer is also in the form of mindfulness and meditation. This could be also in the form of yoga. So it has been proven by simulatory studies, when the person is doing mindfulness for at least 1 month, it significantly decreases the stress level. So regular mindfulness reduces perceived stress and rumination. So techniques could be like body scan, breathe focused attention, loving kindness. So even a minor amount of kindness increases your mood. If you are helping someone, if you are being kind to others, if you are having empathy for others, so that, and so these small steps can also reduce the stress up to some extent, or up to great extent. It seems small, but these are big things. Complementary to therapy and pharmacology, that means this mindfulness and meditation are the additional things which can be done when the person is already taking some drugs for depression or anxiety. So these are the complementary strategies, mindfulness and meditation. So mindfulness could be also in the form of, like, you're when you're performing something, when you're doing some particular work, or when you're writing something, or when you're studying something, you have to focus on that particular thing without distracting your mind. So that is called mindfulness. Even if you're eating something, you have to focus on that without distracting your mind. So this actually minimizes the negative thoughts. Meditation, I already told, could be like in the form of yoga or any prayer. So yoga could be like Vinyasa, Hatha, restorative yoga benefits. So these are the various poses you can learn. Pranayama and diaphragmatic breathing reduces symptomatic. Diaphragmatic breathing means deep breathing and exhaling, deep inhaling and exhaling. So in which the diaphragm movement happens. Exercise prescription. That means the patient or the person who is having the stress will be told, that means how many times they should do exercise. So this exercise would be combined form of all exercise, like stretching, yoga, cardio, cardiorespiratory exercises, aerobic and exercises, and even weightlifting. So this could be the combined form of exercises which will be instructed for in terms of physical modification. So lifestyle intervention, I just briefly mentioned in the previous slides about the lifestyle intervention. So this could be listening to your mental chatter when you are having some negative thoughts. When sometimes it happens that we are having continuously negative thoughts. So that is called a negative mental chatter. So listen to that and try to change those negative thoughts with positive ones. Like you are thinking, that means you will be performing bad in exams because you didn't attend some classes. So how would you change that? By increasing your attendance, by being focused in the class, or like we're expected to perform better in work. So again, in that case, the focus or minimizing that negative mental chatter will benefit create a routine. That means we have to have a routine to minimize the stress. It has been proven by research that the person who has a particular plan, particular routine, particular schedule for everyday's work, like you'll be waking up at a particular time in the morning, you'll be having a breakfast, you'll be going to work, after work you'll be going to gym, and then you'll be having a dinner as early as possible at night, and you'll be sleeping at a particular time. So this particular doing of each and every work during the day reduces the level of stress. It has been actually proven through several studies. Practice deep breathing, I already mentioned. Laugh more. Laugh more, it doesn't mean to laugh continuously. That means having a healthy humor also reduces the stress level. Spend time with yourself. That means we are socializing. Socializing is one thing, and spending time is another thing. We are socializing continuously, but still we need some at least half an hour of time to spend alone in a quiet place to analyze what you did the entire day, what are the bad things, or what are the negative thoughts came in your mind, how to replace those thoughts or actions with positive ones. So that is how spending time with yourself is very important. Digital detoxing. Detoxing is detoxification of like excessive using of phone, excessive using of screen, excessive involvement in the digital world could be detrimental, could be deleterious to the brain health, even the physical health. Because these screen actually releases radiation, it could be uh, affecting the mind, including the body. Meditation, perform journaling. What does it mean? It means if you are having some hobbies like writing or the listening to music or playing sports, out of those is perform journaling. So do that activity or do that hobby. Connect with others, with family and friends, and spend time in nature. Like if you're liking the hills, if you're liking the nature, if you're liking the trees, try to go in those places as much as possible. Nature actually helps to reduce the level of stress. So these are the lifestyle interventions, regular physical activity. I mentioned various types of activities, including the cardio and strength training, aerobic and resistance training, sleep hygiene. I mentioned fixed time, that means making a schedule, and nutrition. So in nutrition is very important for managing stress, like having more protein, having more fiber, and having less carb and almost no sugar. So this is the way to have a balanced diet, and having the diets at a particular time. If you're having the breakfast at 8, and do that at the same time, because that is when you'll be having the best digestion and best metabolism. So nutrition plays a role, including more vegetables, including more fruits, including less sugar and less carb and more protein, as much as protein in your diet will actually shape your mind and body in the best way, and it will finally lead to less level of stress. So digital health and biofeedback, even though these are having some limitations, like it can lead to the burnout or it can lead to stress, but sometimes some of the apps could guide you to do some stress management. So apps are available for cognitive behavioral therapy, mindfulness, and guided breathing. Like they'll be telling how many seconds you have to inhale and exhale, and how many seconds you have to hold your breath. So these are the apps available online. You can wear the some stopwatch, for example, smartwatch, for example, heart rate variability monitoring, biofeedback monitoring. So these can also be wear in the body to monitor the reaction of the body, for example, in the form of palpitation or hypertension. These instruments can be wear in the body, and further to track that and further taking the actions or strategies. So these are the digital therapy. Okay, even though these are having some drawbacks like caregiving expenses and healthcare costs, maternal and early childhood development outcomes, educational attainment, cost effectiveness, workforce participation, economic productivity. Still, the research is going extensively on this digital therapy and digital health, including the artificial intelligence. That means how you can predict. That means this person will be having a stress or not in future. This person might be having anxiety or depression future. So that can be predicted by reading the various physiological and psychological parameters of the body, human body. So the thing is that we have to combine these therapies, both pharmacological and non-pharmacological approaches. So for that, we have to first understand the patient. That means that patient is a student or is a professional or is an elderly person. And further, we have to see that means the level. They are having the acute stress, they are having the subacute, subchronic, or chronic stress. So that will decide the severity and comorbidity. Comorbidity means if the person is having other psychological brain disorder or not. So that can also affect the stress level. So on that basis, we'll be deciding what kind of therapy has to be given to that patient. Therapy both in the form of pharmacological or non-pharmacological. So generally, short-term medications, the medications or pharmacological drugs which I mentioned, like benzodiazepine, barbiturates, or beta blockers. So those medicine can be combined with the non-pharmacological approaches, mainly cognitive behavioral therapy. So in this case, the doctors, pharmacists, nurses, all healthcare professionals play a big role to treat the patient or to minimize the stress in general population even. So one of the case study I have put it here, like if a student is presented with palpitation, that means increased heart rate, poor sleep, that means they are not the student is not getting the normal sleep duration should be around 7 to 8 hours. So the person is having less than that, like 4 hours, 3 hours. Intrusive thoughts, that means negative thoughts are coming in that student. So what kind of plan or strategy has to be taken by the counselor, by the psychiatrist, or by the doctor? So they can be given short-term beta blocker like propranolol, and then the student can be given cognitive behavioral therapy, and they may be directed to have or to get proper sleep, or to sleep at a fixed time and to wake up at a fixed time at night to get 7 to 8 hours of sleep on average. That depends. That also depends. That means the person is having or needing more sleep or less sleep than that. So the outcomes of that treatment is symptom scale and academic functioning. That means symptoms in the form of palpitation or anxiety or heart rate or blood pressure can be monitored. That has been minimized or not, and how the student is performing in the exams. So that could be measured. That means this strategy is working or not. Short-term beta blocker. Which strategy we're talking about? Short-term beta blocker like propranolol, cognitive behavioral therapy, and sleep hygiene. So this was just a case study I presented. So generally, I mentioned initial slides also what kind of population might be experiencing this stress. Among students, it is very common. So they'll be perform better to get good grades, to pass exams. So academic pressure is high on them, but still to manage that, the strategies can be taken mostly in the non-pharmacological approaches instead of taking the drugs. Healthcare workers, they might be exhausted or overworked, and this leads to the mental or moral stress. Elderly population, because of the isolation, because of old age, or because they're taking some other drugs, so that is called polypharmacy, or because they're having some other diseases, all these can lead to more stress in elderly population. Cultural differences, like I mentioned, like when I moved from India to US, there was a huge cultural difference, and I actually went to stress initially, but gradually when I adapted to the work culture about different culture, the stress level decreased. So these are the things which or these are the population which actually goes through more stress in life, including students, healthcare workers, elderly population, and the person who are moving from one place to another. So nowadays the research is going on psychedelics, which I mentioned initially. Psychedelic are the drug which actually targets the psychological pathways. So these are also called the psychotherapy. So these are still in the research phase, not yet in the market. Other strategies: transcranial magnetic stimulation in the depressed patients or the person who are having stress. So these are also extensively research has been done, and this has been proven to be effective. Transcranial magnetic stimulation and neurostimulation. So other strategies for the treatment is personalized pharmacogenomics for antidepressant action selection. Pharmacogenomics is the field in which we try to understand the genetic level of that particular person. According to that, that person is giving the therapy. So this is also being researched highly. So out of these psychedelic assisted transcranial magnetic stimulation pharmacogenomics are the emerging field. However, there are some controversies in this category of drugs, psychedelic. This might lead to addiction or dependence. Still, the research is ongoing, and we'll know in a few years probably. So, future direction is mainly related to the artificial intelligence and digital phenotyping for early detection. That means the techniques which will be telling, that means this person might be having stress or anxiety in future. So that can be done through wearables like watches or other wearables, integrated care models in primary care and universities. That means setting up the centers in education institutes, and actions taken through the administration to minimize the stress level in the general population. So these are the future directions which we are expecting to be taken. Out of these, the AI is the major field. So among the including the in addition to the doctors and nurses, pharmacists also play a role in managing stress, like medication counseling and side effect management. The person is having a drug, pharmacological drug like the barbiturates or the benzodiazepine. They might be depending on that, and they might be showing the adverse effects. In that case, the pharmacist plays a big role to discontinue the drug or to instructing the patient to take the non-pharmacological options. So out of this pharmacological and the non-pharmacological, pharmacological drugs are shows rapid symptom relief side effects which are not there in the non-pharmacological approaches. Non-pharmacological approaches is having almost no side effects. However, pharmacological drugs are sometimes preferred to manage the stress in a quicker time. On the other hand, non-pharmacological approaches are durable skills, fewer side effects, and adherence challenges. Another drawback of this non-pharmacological approaches is adherence challenges. So this means the patient will not be following or will not be adhering to that particular thing. Like they'll not be following a particular sleep hygiene. They'll not be doing meditation. So these are the challenges in non-pharmacological approaches. So everything has pros and cons. Both pharmacological approaches have some advantages in terms of rapid symptom, but disadvantages are also there, like side effects are there. So best practice is to combine both the approaches, both non-pharmacological and pharmacological approaches. It will help us to reduce the dose of the drug, and also will help us to take the lifestyle management, including the nutrition or exercise. So these are the sources you can refer, like WHO, World Health Organization guidelines, American Psychological Association guidelines, Cochrane reviews, various review or and research papers are there. And there's some certain tools to measure the level of stress, like GAD-7, PH29, PSS. So these are the tools which are in the form of questionnaire. You can go through this online and find out your stress level. You can just answer the question and we'll be telling you what kind of stress level you are having. So you can do further readings related to this topic. There's some CBT manuals, mindfulness training programs. So conclusion of this talk is like the hormones plays a role, and stress management requires multimodal approaches. Multimodal means we can take the pharmacological and non-pharmacological approaches. Pharmacology and therapy, pharmacology and non-pharmacology therapy are complementary. That means both has to be given, and not like we are only giving pharmacology approaches, we are only giving non-pharmacology approach. Not like that. We can combine both, and almost everyone, including the pharmacist, is having a role to minimize this stress level. So this was the brief about the pharmacological approaches. If you're having any question, or you can read these questions and try to find the answer by yourself. And further, if you're having any question, please let me know.
Thank you so much, sir.
Thank you so much.
As we come to the end of this insightful session, I would like to extend my sincere gratitude to Dr. Ansar for delivering such a comprehensive and enlightening lecture. Sir beautifully explained the fundamental introduction and pathophysiology of stress, helping us understand the biological and neurological mechanism involved. He further enlightens the pharmacological approaches, explaining how medication and neurochemical interventions can help to manage stress effectively. And what made the session truly enriching was the way he emphasized the importance of non pharmacological approaches like behavioral, lifestyle, psychological strategies for holistic stress management. Sir, your clear explanations and scientific insights have truly broadened our understanding and inspired us to look at the stress management for the both clinical and research perspective. Thank you so much, sir, for sharing your valuable knowledge and guidance with us today.
Thank you so much.